Okay, so good afternoon, students. Okay, okay, so today we will be discussing about the, the another topic, that is superficial thrombophlebitis. Okay, so superficial thrombophlebitis. So from the name itself, superficial. So in which vein it will occur? Obviously, it will occur in the superficial veins. It's not it. So it will occur in the superficial veins. And thrombophlebitis means inflammation. Understand, inflammation. It will occur there. It is thrombophlebitis. Okay, so this is a picture of superficial thrombophlebitis. Yes, and this is the picture of superficial thrombophlebitis. So, what usually occurs here? Here, the blood clot usually occurs here in this superficial thrombophlebitis. Okay. So, thrombophlebitis. Before starting with the superficial thrombophlebitis, what does it mean, thrombophlebitis? Thrombophlebitis is an inflammatory process. Understand? Inflammatory process means what? Means it gets heated, it gets hurt. Understand? So that's why inflammation occurs. Understand? That's why inflammation occurs. And in which this thrombophlebitis, it mostly occurs in the superficial veins. Understand? This superficial thrombophlebitis, it mostly occurs in the superficial veins. And this superficial veins, where does it where it is there, superficial, it, it is mainly near your skin, just near to your skin. Your superficial vein is located, or else it is situated, you can say that. Understand? And this thrombophlebitis, you will see that it is of two types or two parts. Two types, you can say. First is a superficial thrombophlebitis, and the next is deep vein thrombosis, that is DVT. So we will discuss only one topic, that is superficial thrombophlebitis. In the next class, we will discuss about this one, deep vein thrombosis. Understand? Deep vein thrombosis we will discuss in the next class. Okay, so today we will be discussing about superficial thrombophlebitis. Superficial thrombophlebitis, it mainly occurs in the superficial veins. Understand it, and this part, it mostly becomes inflamed. The veins, it mostly gets inflamed. Understand? Okay, so what are the symptoms? What are the symptoms that you will find in the superficial thrombophlebitis? You will find that as there is a blood clot. If there is a blood clot in this area, that is in the lower limb, that is in the leg, what will you find? You will find that it will get warm. Understand? It will get warm. I mean, the temperature, no, it will become warm. And you will find that there is tenderness. Tenderness means it becomes sensitive. This area, it becomes sensitive. And this area, what to say? It pains also. Why? Because there is a blood clot inside this. Obviously it will pain. If something is bleeding inside you, what will happen? Obviously it will be painful, right? अगर तुम्हारे शरीर के अंदर कुछ चोट लग गया, मतलब कुछ चोट लगने से दर्द होता है, obviously होगा ही, ठीक है? तो obviously there will be pain in that affected area, in that affected part. And it will become red in color also. Understand? It will become red in color. Why? Because obviously it's inflamed, it's getting hurt. It's not because there is inflammation inside the skin, that is a superficial vein. So that's why it will become red. And next is pain in the limb. Obviously there will be pain. Next is hardening of the vein. This is hardening of the vein, means the veins it will become hard. Why? Because there is a blood clot. That's why. Only in the skin portion you will find that there is what to say, there is tenderness, there is redness, you will find there. But pain in the limb you will find mostly in this place. Okay, it will become hard. The vein it will become hard. Okay, is it clear about the symptom, everyone?
Yes, ma'am.
Okay. Okay, next is causes and risk factors. What if you have this? If a person have this superficial thrombophlebitis, because of all this, like a person can have all this. First is chronic health condition. If a person's health is too much serious, for example, if a person is cancer, if a person is having cancer, or if a person is having stroke, no stroke. Stroke also I'll teach you in the next class. If a person is having stroke, if a person is taking too much medication, right? Say for example, a pregnant lady, like if a person, like at that time, what happens if she takes too much medication? So it can also be the side effect of this superficial thrombophlebitis. Next is smoking. If a person smokes too much, then the person can have superficial thrombophlebitis. Next is obesity, means fat people, fat, yeah, obesity. If a person is having, means if a person is obese, overweight person or overweight people, they can, means they are at the risk of having this superficial thrombophlebitis. Next is immobility. Immobility means what? If a person stays in one place for too long, if a person stays in place for too long, what happens? Obviously, the blood circulation it won't be normal, right? It won't be normal. So that's why a person will, the blood flow it won't be normal. So that's why a person are prone to have this superficial thrombophlebitis. Immobility. Immobility means if a person stays in one place, if a person stick in one place for a longer period of time. Is it clear till this portion? Causes and risk factors. And in immobility, I'll tell you one example. If you are traveling, if you are in a journey, right? So what happens if you sit in one particular place for too long? Sometimes your leg it swells, right? Why? Because there is no proper blood circulation. So that's why your leg portion it swell. And so for that, like you need to move often here and there so that there won't be any swelling. Okay, is it clear? Causes and risk factors.
Yes, ma'am. Yes, ma'am.
Okay. Okay. Next is prevention. How can you prevent yourself from not getting the superficial thrombophlebitis? First is take a walk. You should take a walk so that your blood circulation it will be good. It will be good for the blood circulation. So you should take a walk or else exercise. And for the patient like who can't walk, like if there is too much pain and all, like you can ask the patient to perform ROM, that is range of motion exercise. I have taught you right in the class, in the previous class. I mean, when you all were in university, I think I have taught you that range of motion exercise. So you can teach like those type of exercise also to the patient. Okay, next is drinking plenty of water. You can ask the patient to drink plenty of water. Why? Because if a person drinks plenty of water, the blood circulation will be good. I mean, uh, the blood it passes like I mean the way or the pathway where the blood pass and goes to the different parts of your body, right? It goes to the different parts of your body. So the pathway or that pipe If you drink water, what will happen? The part, no, it will become thinner in size. If it becomes thinner in size, what will happen? It will be easy for the blood to flow to the different parts of your body. So that's why you should drink plenty of water. Okay, and you can drink fruit juice and all also, except alcoholic things. You can't drink that. But apart from that, you can drink. Okay, is it clear about the prevention part, everyone? Okay. Okay, thrombophlebitis. What does it mean? Which person? What do you mean by thrombophlebitis? Which person? Can you hear me? Which person? Okay, Rudolph. Can you hear me? Rudolph. Salam Girija Devi. Can you hear me?
Yes, ma'am.
What do you mean by thrombophlebitis? Salam.
It is the inflammation that occurs in the vein.
In the vein. Right. Okay. Okay. So
Yes, ma'am.
two types are there, right? So can you name them?
Yes, ma'am.
Please name them.
Superficial thrombophlebitis
Phlebitis.
and deep vein
Thrombosis. Thrombosis.
thrombosis.
Okay. Okay. Good. Okay. Next, Rashmi Sonwar. Can you hear me, Rashmi?
Hello, ma'am.
हाँ सुनाई दे रहा है. Can you hear me?
Yes, ma'am.
Okay, Rashmi, can you tell me in which part of the vein this superficial thrombophlebitis occurs?
Neck,
In the superficial vein or else deep vein?
superficial vein.
Okay, superficial veins. Can you tell me at least, okay, any symptoms? अगर ये superficial
Ma'am,
thrombophlebitis होने से हम लोग को क्या देखना मिलेगा, मतलब एक इंसान का पाँव में.
redness, pain,
Okay,
warm,
redness, pain, anything else?
warm,
Warm. What? क्या बोला?
ma'am, warm,
Oh, warm. अच्छा. ओके, और वेन्स कैसे होगा, सॉफ्ट या फिर हार्ड होगा?
ma'am, vein hard होगा और जो skin है वो soft होगा.
अच्छा, और रेड रेड भी होगा, है कि नहीं, मतलब लाल लाल होगा क्योंकि अंदर में इन्फ्लेमेशन जल रहा है, कुछ जल रहा है कि नहीं, तो उसके वजह से लाल कलर हो जाएगा. ठीक है रश्मि? ओके. मर्सी.
Yes, ma'am.
ओके, कैन यू टेल मी the causes or else the risk factors for this superficial thrombophlebitis?
Yes, ma'am.
हाँ, tell me.
Uh, Chronic health conditions, smoking, obesity, immobility, and certain medications.
Okay. Okay, very good. Okay, next, Sheetal.
Yes,
Okay, Sheetal, can you tell me the prevention part? How can you prevent yourself from this superficial thrombophlebitis? Can you tell me?
by taking a walk.
By taking a walk. Okay, anything else? Okay, why do we need to take a walk? What is the purpose? हम लोगों को क्यों चलना चाहिए? Means why? What does it improve? Yes, what does it improve? What benefit will you get if you take a walk?
Mm, heart circulation.
Okay, circulation. Yes, very good. So obviously, if you take a walk, the blood circulation also it will become. I mean, it will become rich, right? And your health also it will improve better. If you stay in one particular place for too long, the blood circulation also it won't be there. I mean, the function it won't function properly. So that's why you need to take a walk. And the second one,
Drinking plenty of water.
what?
Drinking plenty of water.
Okay. Also same thing, huh? Just drinking plenty of water also it will be same thing. So that your blood circulation it will become rich. That's why you need to drink lots of water. Okay, I guess it's clear now, everyone, today's class. Okay, whoever are there, can you show me your copy then? So that in the next class, I won't ask you any more to show. Who are ready? Can you tell me?
Ma'am, I haven't completed my diagram.
Okay, I'm asking who are ready. You can show me. Darshana is already done. Anyone else who is ready to show? Who's ready to? Okay, Rashmi. Okay, keep on turning the page. Whoever didn't complete, it's okay. You can show me in the next class. रश्मि हेलो
मैम
हाँ हो गया ना हेलो
मैम
अच्छा अच्छा ठीक है तुम्हारा हो गया एनीवन एल्स इज रेडी है मैम शेली आर यू रेडी
Yes, ma'am.
आर यू रेडी
Ma'am,
नॉट कंप्लीट
नहीं वो डायग्राम थोड़ा बाकी है.
ओके okay anyone else who's ready mercy and all are you not ready
Ma'am, I've written all the notes, but the diagram is incomplete.
on the diagram okay please try to draw the diagram also
Yes, ma'am.
okay that means only Rashmi has showed me right others Rashmi and Darshana
I finished, ma'am.
That's what Darshana and my oh Salam also finished. Okay, Salam show me. Salam, I can't see anything. I think it is okay. Show me your diagram. You keep on turning the page, Salam. Salam, your connection is lost.
Yes, ma'am.
Keep on It's okay, Salam. You can continue in the next class. Your network is too bad. Okay. Okay then. That's all for today's class. Thank you. I hope it's clear to you all. It's clear now, everyone? Yes?
Yes.
Okay. Okay then. Thank you.